travel. At today's webinar, we're presenting the challenges of preventing violence in an economic recession whilst maintaining a rights-based and trauma-informed approach. And I'd like to welcome our panel and thank them profusely for coming along, each one bringing their own unique perspective to this discussion topic. So on the virtual sofa today, we've got Susan McVie, who is Professor of Criminology at Edinburgh University. She's also co-author of a longitudinal study called Youth Transitions and Crime, which has been analysing crime trends since 1998. So welcome, Susan. Joining Susan on the virtual sofa today is Niven Rennie. And Niven is Director of the Violence Reduction Unit, which is Scotland's National Centre for Expertise on Violence. So welcome, Niven. And last but not least is Meg Binns, who is lead practitioner at the Cairn project at Edinburgh's City Youth Cafe, or 6VT, as it was formerly known. And the Cairn project is a project that provides tailored support to the young victims of crime. So again, a unique perspective offered there. So just a little housekeeping for everyone else before we get started. We are being recorded. There's a big message that's just come up. So if you don't fancy being shown, you're welcome to turn your videos off. We're going to remain muted throughout, but you can make comments and ask questions as well in the chat facility, and we'll try and get everybody's kind of viewpoint noted, and hopefully we'll have time to answer your questions. That would be great. The chat box is usually found at on the bottom of the toolbar. So really just setting a little bit of context before we dive straight into our kind of prepared questions. Well, they're not that prepared. So 2020, well, what can I say? It's been bizarro world, hasn't it? It's been an extraordinary year. And I think as we draw to its close, we've really got to reflect on the impact of COVID-19 on the most vulnerable in society. The pandemic's really shone a light on the injustice of inequality, and this is from the protests of Black Lives Matter through to public inquiries into disproportionate COVID-related deaths. So really looking at the social determinants of health, those economic, social, education, living and working conditions that affect healthcare and health status. Will they lead to disparities in just about everything? Life opportunities, wealth and income, social mobility, life expectancy, and the distribution and exercise of power, including justice. So the impending economic fallout from COVID-19, and I'm thinking about Rishi Sunak's admission yesterday that the GDP is the worst it's been for 300 years. The impact of this on an already weak economy compounded by Brexit. We don't know what's happening there, but it's probably not going to be good. It's a really scary prospect. And the overwhelming evidence that we have is that recessions impact hardest on those who are the most vulnerable. In the last recession, which was around 12 years ago, after the financial crash, violent crime was at an all-time high in Scotland, and Glasgow then was known as the murder capital of Europe. So have we learnt lessons since then? And how do we meet the current and future challenges of preventing violence in an economic recession whilst maintaining a rights-based and a trauma-informed approach? So I'm going to start off by asking Susan, why was violence and knife carrying in Scotland more prevalent 12 years ago? Seems like an obvious starting place. Over to you, Susan.
Thanks, Vicki. Actually, the violence rate started to decline before the financial crash, interestingly, and continued to decline after the financial crash, which I think shows that you can still change crime even in the context of economic recession. But to come back to your question, I think we know that violent crime rose hugely after the Second World War in Scotland, as it did in many other countries. Partly that was due to better reporting to the police and recording by the police, but there was a change in behaviour over time. It peaked in around the early 1990s in Scotland, and then it remained high up until around 2003, 2004, before violence rates started to fall, just around the time that the high profile focus on violence was starting to emerge in terms of policy around the establishment of the Violence Reduction Unit. I think there are quite a number of reasons for high violence at that time. Obviously, levels of poverty, joblessness and social deprivation were very high in certain parts of the country, and that was partly historical and partly a result of deindustrialisation. So the closure of Ravenscraig, the closure of coal mines had major impacts on lots of communities across Scotland. There were high unemployment rates, and violence is a known response to economic and social stresses caused by these problems. So there were economic factors, levels of addiction in certain parts of Scotland. I mean, in the 80s into the 90s, there was a major heroin epidemic in Scotland. There's been a long-standing issues around alcohol addiction as well. And these have been key drivers of violent incidents in different ways. Obviously, we've had drug-related territorial behaviour that's impacted on violent crime rates, but also alcohol-fuelled gang fights. And then, domestic violence is also fuelled to a certain extent by alcohol. We have to also remember that there are cultures of violence in Scotland, especially kind of going back 20 years. There's a long-standing male-dominated traditions of responding to challenges or threats or insults using violence, and a tendency to deal with problems independently rather than to ask the police to deal with those, and macho cultures of violence towards children and women. I always think of Billy Connolly when I think of that, his kind of sketch about, his dad saying, "Don't you dare do that again," kind of clipping him round the ear. And I think that was common. I think back to my childhood, and I remember that happening round about me. Interestingly, Lancaster University did a piece of research in the late 90s to look at violence in Scotland and how it compared with England and Wales. Actually, I think it was just England, not Wales. But they found that actual levels of violence overall were quite similar. It was levels of serious violence in Scotland that were the real problem. And I think that's where we've always had a particular issue, is that when people, and particularly men, young men in particular, go out to commit violence, they don't go in half-hearted, and the knife culture that existed in certain parts of Scotland meant that the consequences of violence in Scotland have always been that little bit more serious. There were also, I think, issues around relationships between the public and the police. So that meant that violence and other forms of crime, of course, wouldn't be reported. Police were treated with suspicion. History of conflict between the police and gangs in some communities, which continued to exist, I think, right up until the early part of this century. And of course, that meant that the traditional police response to violence was to deal with the symptoms of the problem, lock up the perpetrators, rather than to examine and deal with the causes. And then the other thing that was different, I think, 15, 20 years ago, was there was a real lack of support or opportunity for anyone who wanted to leave a life of violence. So cycles of violence just continued to perpetuate themselves within families and communities because there didn't appear to be any exit strategy. So I think it's a complex problem with many underlying causes. It's not one thing that you could point to, but that's some of the reasons I think that violence was higher back then.
Thanks for that. It's a really good kind of broad brush stroke picture of what Scotland's been like. And I guess if anybody else would like to comment, Niven or Meg, before we move on to the next question.
I think it flows into the next question. I really enjoy sharing the platform with Susan, because we come at this from two different angles, come up with the same answers. So I would just echo what Susan had to say about where we've come from.
Well, funnily enough, Niven, you're up next. And the question I would put to you does actually flow on from that, which was looking at how Scotland has changed and what does this tell us about violence prevention and how it's worked.
I think there's that's a really quite wide question, and I think what's happened is, well, Susan talked about where we were 2005, the murder capital of Europe, the most violent country in the developed world, allegedly. That's when the Violence Reduction Unit started, when we adopted the public health approach. And there was two key factors to where we've come from. There were 137 homicides in 2005, 64 last year. So there has been a reduction in homicide, there's been a reduction in it, and we have to celebrate that fact. I think the two key factors that really played a part in that were the SURF campaign, the Community Interaction Reduced Violence, which coincided with Strathclyde Police's Gangs Task Force. So it's a sort of carrot and stick approach, which broke the back of the territorial gang problem. And though it still exists to a certain extent, that problem has largely been reduced to a stage where it doesn't contribute the same way to these statistics that we covered. And I think both played a part in that. The second element was the education element, the Mentors in Violence Prevention, the Medics Against Violence, all the education programs. And so we were engaging with young people earlier. But I think what concerns me now as Director of the Violence Reduction Unit is that we still have a tendency to silo everything. So we tackle drugs, we tackle alcohol, we tackle violence, all in a siloed approach. When we know that these things are all connected, as Susan said, they're driven by poverty. And the issue we have is that the reductions that we've seen in some areas of Scotland have not been replicated in our real poorest areas. And our areas of multiple deprivation still carry a lot of scarring. And the public health approach is great, and we can celebrate what we've done in violence, but instead, we're top of the league for the drug death statistics. We've got a huge problem with male suicide. We've got a homeless issue. We've got gambling addiction. We've got alcohol addiction, which has been the biggest blight in Scotland's record for generations. And we haven't got a joined up approach on how we're going to tackle that. And my recent conversation with Police Scotland is they're looking at having a new violence strategy. And I've been saying to them, if it's not going to start pre-birth, it's not going to be worth the paper it's written on, because you actually need to engage and give support to families at the start and deal with the issues of poverty in these communities. So I think the final thing that I would like to say about where we've changed and how, I think the public health approach has allowed us to recognise that the police are not responsible for violence. The police have a role to play and have something to do about suppressing violence, but tackling violence is far wider than that. And it's an end-to-end approach that requires all agencies to be involved. But the problem I've got is, despite the fact we've been talking about that from 2005 onwards, and it's gradually found a momentum in England and Wales and elsewhere, as soon as the crime figures go up, it's the police officer that's behind the microphone, which again places that level of responsibility on them to say, what are you doing about this? So we can't have it both ways. And I think that dialogue needs to reach political levels, because actually a lot of the policies that we pursue are contributing to the problems that we're seeing on the street, which gets into the whole dialogue about austerity and such like. But that's my view of where we are.
Thanks for that, Niven. And I think, we are seeing justice, inequality, this violence is really difficult to shift out of some of those areas that are the poorest. And we've also got this looming recession on the horizon, which could indeed be one of the worst recessions of our lifetimes. So that leads on to the sort of doom and gloom question, which Susan, I'm fielding to you, sorry. Do you think things could get as bad as they did during the last recession, or indeed any recession that's been?
Well, as I said earlier, interestingly, violence continued to go down in Scotland during the course of the last recession. And there's quite a complex relationship between economic recession and crime. It's not a linear relationship, and there's often a time lag in terms of how long something can take to influence. And the question is not so much what impact does the economic recession have, but it's what efforts are made to mitigate the effect of an economic recession that will impact on crime. So, it's important to consider that the recession, I think, is likely to hit certain people hardest. You've already mentioned, Vicki, that it will hit people from deprived communities and vulnerable people hardest. But the reality is that it will hit young people, especially young men, and especially young men from deprived communities. And that's exactly the group that where we've seen the biggest reduction in violent crime in Scotland over the last decade or so. So they are the high risk group, if you like, in terms of the impact, not only of the pandemic and the economic and social impact, but also, you know, what might happen in terms of their behaviours. If you look at the most recent statistics that were published just this week and presented to the Scottish Police Authority Board, recorded crimes of violence are actually 8% down this year compared to what they were last year, mainly due to a reduction in common assault. But that kind of hides some worrying underlying trends. So violent crime in July and August this year was actually higher than it was in July and August last year. So there was a big dip in violence right back at the beginning of the pandemic. I mean, this is according to police statistics, so of course it's subject to all the kind of vagaries of the fact that if people don't report it, then it doesn't get recorded. But we saw when people were released from lockdown, there was a bit of a spike in violence in the summer. Attempted murders are up this year compared to last year, especially in the north of Scotland. Robbery increased during the course of the lockdown, so that in that initial kind of lockdown period between about April and July, robbery levels had gone up. They're kind of back to normal now, but they did increase. Common assault against emergency workers is up. Threats and extortion have increased, and a lot of that is online. So we tend to kind of forget that violent crime, if we think of it in its broadest terms, can also happen, you know, not just on the streets and in homes, but in online communities, and we see that increasing. And most worryingly of all, we've seen an increase in the use of offensive and bladed weapons, an increase of about 13% this year compared with last year. So there are some worrying underlying trends, even though the big picture shows that there's been an overall reduction. So the pandemic has, oh, sorry.
Can I put some context on that? Just
Sure.
the COVID has really contributed to a lot of that fall. The one about robberies, again, COVID's contributed there, because robbery is a crime of desperation for people who are needing money for their drug addiction or whatever. You don't have people in the street to police the street, so it's a lot easier to, you know, having people about prevents robbery. So the other one about weapons was a reclassification issue. We're actually looking at that ourselves. There was so the police didn't if somebody was assaulted with a knife, they were recorded the assault and not the knife. They've reclassified and started recording. So the big jump in weapons is not really a huge jump in weapons from the previous year. It's due to more accurate recording, and some of the weapons that are being recorded, particularly around schools, are things like school bags and rubbers and rulers and such like. So we need a more detailed examination of what that weapon carrying is. But certainly I agree with you, some of the underlying statistics are still there to be looked at.
Yeah, I mean, my understanding is that you can't do a long-term comparison because of the reclassification of weapons, but you can compare it to last year, because this came in before last year. And I'm talking about bladed weapons, not just, you know, rubbers and rulers.
We have to get a closer look at this. Our team are looking at it with the Police Scotland statisticians. I think the first year when they did the reclassification, they didn't quite get their head around it, and so not all the reclassification was done. It was a more accurate. I think we're looking at something around 66% now being recorded. So potentially we're going to have another jump, but a lot of it's down to classification. But it's good that we're getting to the bottom of it.
Yeah, I mean, there may be little kind of quirks. I mean, overall though, I think we can see that the pandemic has had an impact on different types of violence in different ways. And the key issue is that the pandemic has created some of the conditions by which violence thrives, especially in the hidden places, especially in the home. And I think we've yet to see what the impact will be on domestic violence. Police statistics are not a particularly great indicator of how that's changing, just because people don't always want to report. And of course, most domestic violence, in other words, violence in a domestic setting, is still men being violent towards other men. I think that the other thing that's really concerning is the impact that the pandemic has had on services, supports and third sector organisations. So the reduction in violence across Scotland over the last decade or so has been maintained to some extent by better service provision, and, you know, supports for those who have addictions and things. There were signs before the pandemic that was starting to slip in some areas, and it's possible that will continue. So I think, as Niven says, in the course of a deep recession, it may well be an impact on economic crimes might start to become a bit more aggravated. So shoplifting and housebreaking might become more aggravated. I think the main thing is that we need to remember to maintain that public health approach to reducing violence. And we now talk about public health more than we ever have before. But that's about understanding the underlying causes and working in partnership to minimise the impact of the pandemic. The pandemic had, I was just going to say, and the pandemic hasn't really created inequality. It has exacerbated all the inequalities that were already there beneath the surface.
I think it's at this point I'd like to bring in Meg. Susan, you mentioned services and the impact that this has had on services, and I think that's been really significant because it's built upon kind of quite weak foundations of austerity, you know, with services really suffering. We talk about the public health approach, and that needs to be just a wider partnership than just organisations like the VRU and NKBL. It also has to involve these smaller community-based organisations that can actually reach out and work with both victims and perpetrators. So Meg, moving on to you, could you tell us some of the challenges that you face and what you think widely the challenges are, but also the challenges for services like the Cairn project?
Absolutely, yeah. I resonate with a lot of what Susan was saying there, because I think as time's going on, you know, to prevent violence, it is about, you know, appropriate and significant, you know, support and resources for young people, either perpetrators or victims, and working at that sort of early intervention stage. But to make that happen, everyone, I'm sure, who works in the third sector will hear this all the time, but it is ultimately down to funding and sustainable funding, which seems such a shame to always talk about funding when it's people's lives that we're talking about, but unfortunately for work to be implemented and be effective, it is ultimately down to what money and what resources we have. And, you know, like so many people here, I'm sure will understand that cuts are made to funding as the rise of support is needed. As we've seen, you know, through the pandemic, you know, there's been a significant fall in, you know, funding opportunities. Like there's lots of third sector organisations kind of, I don't want to say fighting, but kind of fighting for the same pots of money, which makes, you know, people's jobs very, very difficult in that prevention work. And I guess there's other elements regarding funding, like, you know, there's some organisations don't receive any kind of council or government funding. So they're heavily reliant on grants and funds. So for example, the Cairn service, which I lead on, we get all of our funding from the National Lottery Community Fund, which runs out in 2022. And we've already been kind of told that once that money is done, it's done. So it does kind of make our job a little more difficult because we've got to be looking to the future and be planning really far ahead to ensure that these services don't just drop away because they're needed. And I think as well, we've seen at 6BT anyway, you know, personal donations, they're lessening because people's priorities are shifting, because people, you know, during a recession, during these difficult times, their priorities aren't to support charities, they're to support themselves at home and their families. And so, yeah, it's been a really insightful and yeah, the start of a very difficult time, I think, in prevention work. And I think what we've seen as well already is that, you know, young people, when they don't have money, there's boredom, there's frustration, there's, you know, mental health and mental well-being difficulties, financial difficulties, self-esteem difficulties, and then that can, you know, have a bit of a domino effect onto difficult and challenging behaviours. So I think, yeah, we've got unfortunately a difficult time ahead, I think.
Can I just add to that, Vicki? I spent a couple of years as a CEO in the third sector, and I got my eyes opened, having spent most of my career in the public sector, is how difficult it is. And our team are working in a Saracen area of Glasgow. Some of them are on here. working with third sector organisations. And my observation is we need to find a new funding model. Yeah. Already seeing a lot of the youth services being withdrawn in that really important area because we're anticipating cuts and the cuts are starting. And so that's the first thing. The second thing is, because of the way the third sector is designed, they don't tend to work together. They protect their own budget and protect their own organisation. So one of the things we're trying to do is bring third sector organisations together, to join together, to present. And there's a real problem doing that because, for understandable reasons. But until we understand the importance of the third sector, the importance of youth work, and fund that properly and give these health workers, drugs workers, alcohol workers, family workers the support they need, we will continue to have this staccato approach where they're all fighting to get to charitable bodies to get a small pittance of money to keep them going. And it's such important work, and it needs to be recognised politically.
Absolutely. I think, yeah, you've hit the nail on the head. And I think it is about, as you say, youth work is such a needed provision. And I think sometimes youth work, frustratingly, can be put on the back burner a little bit, where youth work could be implemented in so many different environments and support young people in lots of different ways, really alternative ways. I think it could be used in a really exciting and really incredible way, but ultimately it is down to money, which is, yeah, very frustrating. You can probably see it in me.
I think amongst some strategists, they still see the third sector as the charitable sector, which is really disappointing. Yeah. Because it's the work they do is thrown open to tender, so you can lose contracts and lose overnight, even though you're doing a good job, and the people there performing that job don't get the recognition. The organisations are not big enough for them to have a career structure. So it is really unfortunate that we decided to go down this route of treating the charitable sector as second-class citizens. And where that goes, I'm talking to another local authority in Scotland just now, where they've got a real problem in a particular area, and they've had an action group to deal with it. No third sector representation. Nobody has even thought that the third sector should be at the table. So that there is a real issue there that we're going to have to tackle.
Agreed. I think that's exactly right. I have been in the voluntary sector all my life, and we certainly don't get the recognition or the funds that are required. We're always constantly having to chase them. So thank you both for making that point. There's been a couple of questions coming. I think before we move to that question, I'd just like to go back to you, Meg, because you have a unique perspective working with the victims of crime, and I would ask you the question: what does justice look like from the perspective of a young person?
Absolutely. For this question, I actually decided it would be important to ask young people that I work with. I thought that was the most to get the most authentic kind of an honest answer, go to young people. And when I was looking through some of their feedback, some key words were kind of like emerging from what they were saying, and I'll give some quotes shortly from what they said, but the key themes that were coming up were fairness, being listened to, being believed, being respected, and being trusted. And these are words that we bat around all the time, but I think hearing this coming through from so many young people makes it, seeing that maybe they don't feel these things, maybe they don't feel like it's a fair justice system at the moment, or that they're being listened to. A couple of really powerful quotes which I thought I'd share. I've got loads, but I had to sort of choose a few because I'd be here for days. So one young person said to me in response to this, she said, justice is freedom in a way. It kind of makes you feel relieved, like finally I was taken seriously. Another young person, this is a slightly longer one, she said in response to this, if you think about it, the justice system, like my experience with the court, has just been horrific. I feel like you have to fight to get justice, which just doesn't seem right. When you look at the #MeToo campaign, there's people fighting for justice after they've been a victim of sexual abuse, rape, etc. And when you look more recently at #Black Lives Matter campaign, people are having to protest for justice. People of colour are getting shot and killed on a daily basis just because of the colour of their skin, and people that also get raped or sexually assaulted and aren't always believed. And sometimes it's suggested that these victims wore the wrong thing and they were told they were asking for it, or they were too drunk. So justice to me is, it's hard to explain in words, kind of like getting what you deserve, people having principles and values and knowing right from wrong. So I guess justice is about making that the perpetrator know what they have done is wrong, and then you can walk out feeling safe again. I thought these were really powerful responses to what justice is, and I think the young people that we work with on the Cairn service that works with young victims and witnesses of crime, it is about being listened to. It is about having a voice and being heard. And I think young people have told us before they accessed the Cairn service, they didn't know where to turn to, they didn't know who to speak to, because they just felt like there was no workers or no professionals that would listen to them and their experiences. So I think, yeah, services like this one is, they're essential for young people to get justice. Hope that answers.
Yes, and I was going to say, do you think? I mean, this is to all the panel. Everyone on the virtual sofa gets a chance here, but do you think young people get the justice that they deserve? Sorry to lay a heavy question on you.
Not always. I think young people we work with, I think, don't understand the justice system, and I think that's the same in adults. If they've never had to interact with the justice system, there's no reason to know about it. And I think some of the young people that we've worked with go in thinking, they'll get 20 years in prison kind of thing. So it's trying to kind of manage expectations and manage the situation with the young people and support them kind of throughout the process from the point of reporting, and then also after, if it does make it to court and to a hearing, it's then supporting them afterwards, because in Scotland there's 3 outcomes, and I think sometimes young people don't understand the process and don't understand kind of the terminology and the jargon, and I think it is about kind of making sure there's youth workers. I'm a youth worker, that's what I am, but I think it is about breaking it down and making sure young people understand what the process is. So I think, yeah, some young people do get justice where others might not get the right justice that they were maybe initially anticipating or hoping for.
Okay.
I would like to look at it from the other way. I think we're starting to come a journey which we've only just begun. We're looking at the criminal age of responsibility, and rightfully that's being raised, and it should even go higher. Second thing is, and you've got that your part of your theory, your conversations about trauma informed, and we've got people like Ian Smith and Tony Bowen who are now in the courts talking about trauma informed. And I think our judiciary need to understand young people better, and the start in life and the adverse child experiences and how that impacts on them. And also, people have got to be allowed to make mistakes. And I think we've got numerous people in our justice system who have made a mistake, and they'll put their hands up and say, yes, they got it wrong. We need to be more forgiving and compassionate as a country. And just because you've got a criminal conviction, it shouldn't prevent you from building a proper life and moving on. So I don't see this as being the responsibility of young people. I see it being the responsibility of the justice system to be more compassionate. And I think we're starting that journey.
Okay, that would tie in nicely with my last question. But before we go there, we've had a question in from Hannah, who has put it into chat about bridging the gap between evidence and policy and practice change. I think we've gone some way to kind of answering that question, but does anyone have any thoughts on that?
Yeah, could I maybe address that? Because I was thinking about that when Megan and Niven were talking about the role of third sector organisations and support services, and I wrote down evidence and outcomes. At the end of the day, whether a service receives money is down to a set of bean counters who very often don't know anything at all about the subject, and what they want to look at is the bottom line. Did the amount of investment that we make save us money in the long term? And very sadly, I think data and evidence are increasingly important, especially during a time when we are going to be constrained in terms of the public purse. There's really great evidence about success in Scotland if you look for it, but it takes a long time. This is the complicated thing. You can't, as Niven was saying, to get the best bang for our buck now, we should be investing in the kids that are being born now, because long-term prevention means that you're going to have much better outcomes later on, although it's not quite as simple as that, because you need kind of different services, age-graded services at different stages. But I do think that you know, we are going to have to get better at collecting evidence and being astute about data in order to demonstrate to the policymakers that make all the decisions that these are policies that work. If you take a step back, we can see that the implementation of GIRFEC in Scotland and the establishment of the whole systems approach has, over a longer term, paid dividends. We've got far fewer kids ending up in the youth justice system, so they don't end up in the adult criminal justice system. That's a huge success. The numbers of young people in Pullman are tiny compared to what they were 10 or 20 years ago. So that these are real measures of success. But to keep that going, we need to be able to demonstrate the value of that to those people that need to look at the bottom line. The other thing we still do about children in this country and in other countries is we split them up into victims over here and offenders over there, and we don't look at the overlap between the two and understand how, if you deal with a victim effectively, they're less likely to offend. And if you deal with an offender effectively, they're less likely to be a victim later on. We still haven't got to the bottom of that. And Niven's right. Trauma, poverty, and what we do to kids when we stick them into systems and don't deal with them effectively are the three main things that make them worse in the long term.
Susan, I think you might have answered your own next question there, but we've got very limited time left. So if you could describe to me, and you've mentioned things like trauma-informed approaches, we've mentioned restorative practices and what justice looks like to a young person. But picture this, Sicily, no, not Sicily, but a fair and just Scotland in 2030. And you've got a minute to describe your vision. So we'll start with Niven.
Oh, you said Susan, Alex. You're throwing me.
We'll start with Niven.
I was sitting waiting to hear what Susan was going to say so I could agree with her. You know, a fair and just Scotland. Well, I have a vision. I talk about it. If you look at my Twitter account, it's there as a tag tweet. It needs to be a complete rearrangement of services right across the board. We need to stop looking at government departments and allocating money to government departments so we spend over and over and over again for the same people. We need to actually look at the service users and see what they need. And we need to be bottom up, not top down. And we need to have joint approaches and shared approaches and see if we could tackle poverty in Scotland. Actually give people, Callum's on here listening today. He talks about a lethal ambition, lack of ambition, lack of hope, lethal absence of hope in his life. If we can give people hope, a Scotland where they have a future, they're not labelled and they're supported and we believe in them and we understand the difficulties they've encountered, I think we'll be in a far better place. And 10 years would be fantastic. In 10 years we could do something. So let's set that as an ambition for 2030.
Susan.
Oh, this is where I get to agree with Niven for a change. Okay, I'm going to quote Aristotle from over 2,000 years ago, who said that poverty was the parent of revolution and crime, and that's still as much the case today as it was then. So for me, a fair and just Scotland is one that reduces poverty and inequality. It would see greater equality in terms of economic prosperity as we come out of this pandemic, greater equality in terms of educational opportunity, greater equality in terms of employment expansion, less addiction, better services for mental and physical health outcomes. So bottom line is poverty and inequality.
Okay, thank you, Susan. Meg.
This is my opportunity to agree with you both.
We're all agreed.
No, I think, yeah, I do agree with you both, but I think, yeah, trauma-informed, I think making sure that all professionals and practitioners, volunteers, whoever you are, you know, trauma-informed, and organisations are trauma-informed. So it's not just the individual, it's the organisation. Looking at developing things like the Barn House, which is a whole different conversation, but which is supporting young victims in a child-friendly and victim-focused approach, and yeah, tackling poverty issues and working jointly is the way forward. Absolutely.
Okay, thank you for sharing your visions with us, and I agree with all three of you. I'm afraid that's all we've got time for. I'd like to very much thank our three panel members for sharing their insights. It's been really interesting. I'm sure there's lots to follow up on as well. And just to thank everybody for listening, you know, and I'd like you all to picture a fair in just Scotland in 2030 and maybe let us know what you see there. But thanks everybody for coming along. Sorry about the earlier hoo-ha signing in, and take care.
Thank you.
Thanks very much, Vicki.
Thank you all. Brilliant. Loved it.
Great. Thanks so much.
Thanks,
guys.
Meg. That was great. Thank you so much.
Thank
That
you
was
so
really
much.
good to get your perspective.
Thanks.